Over the past few years, mental illness has been something very prevalent in mainstream media, such as in the Showtime series Shameless. The show's main plot revolves around an impoverished family living in Southside Chicago. Two of the show's main characters, a mother and son duo named Lip and Monica, both suffer from bipolar disorder. Many of the show's main plot points revolve around Lip and Monica's various mixtures of manic and depressive episodes. Their depressive episodes consist of times when they don't want to communicate with the rest of the family, and they lay in bed all day and are unable to complete any daily tasks. The two often describe these times as feeling hopeless, and they do exhibit suicidal tendencies. While on the other hand, Lip and Monica both exhibit manic episodes, where they perform reckless actions and do not think about the consequences that come with them. Bipolar disorder, also known as manic depression, causes unusual, dramatic, or intense shifts in moods or energy or activity levels. More than 5.7 million American adults, or 2.6% of the population over 18 or older in any given year, have bipolar disorder. Many famous actors and artists and political figures have been very open about having bipolar disorder. People like Mariah Carey, Kurt Cobain, Carrie Fisher, and Winston Churchill. However, there are still many people today who do not know the disorder exists or even realize that they may be living with bipolar disorder. While scientists may not have pinpointed exactly what causes bipolar disorder or where in the brain bipolar disorder affects, many have concluded that it is primarily in the frontal lobe, which can control mood, personality, emotions, behavior. Other studies have shown that through fMRI scans, patients with bipolar disorder have reductions in gray matter in the prefrontal cortex compared to patients without bipolar disorder.
So how do you know if someone has bipolar disorder? The key factor in pinpointing if someone has BPD is figuring out if they have manic or depressive episodes.
When you're in a manic episode, you feel like you just drank 10 cups of coffee. You're wide awake, have trouble sleeping, you are speaking very fast and burning through topics in conversation. However, this period can also present itself with agitation and abnormal and impulsive behaviors. Now, the manic episode is not always a bad thing. People are usually productive, but it's also to an abnormal level, such as cleaning every surface in your house at 3 a.m. or cooking your entire family breakfast before they wake up. The mania side of the disorder can also be destructive. People tend to be impulsive and take dangerous risks like spending a lot of money or having risky sex.
On the other hand, there are depressive episodes, which are described as being the opposite of manic episodes. People feel very unmotivated and have a very minuscule amount of energy. People also find it very difficult to eat and often find themselves with thoughts of suicide. There is also a severe drop in concentration, slow motor skills, and memory loss. People often feel hopeless or like they can no longer enjoy things. People can recognize this as not even wanting to get out of bed or bathing because they are too unmotivated to do so.
Bipolar disorder is separated into 3 categories. There's bipolar 1 disorder, which is manic or mixed episodes that last at least 7 or so days. Then there's bipolar disorder 2, which is a pattern depressive episodes shifting back and forth between hypomanic episodes, but no full-blown manic or mixed episodes. And then there's cyclothymic disorder, which is a mild form of bipolar disorder. People who have this disorder have episodes of hypomania that shift back and forth between mild depression for at least 2 years. However, the symptoms do not meet the diagnostic requirements for any type of bipolar disorder. There is evidence of a 4th one, and it's people still do experience episodes of mania and depression, enough that it's unusual from their typical behavior, but not enough that could be diagnosed into the 3 categories.
Many different factors can cause BPD, and the most common association is environment. Children and even adults who may live in abusive households may develop BPD, as well as extreme stress, significant loss, or any other traumatic event. BPD can develop. However, there's a slight hereditary aspect of BPD. While it is considered a genetic disorder, it is not a determining factor. In other words, if a child is born from a parent with BPD, it is not guaranteed that the child will have the disorder. Evidence can be shown through many numerous studies, one indicating that a child was diagnosed with bipolar disorder, but their twin was not. There are some people who are more at risk to be diagnosed with bipolar disorder. These people who are already diagnosed with anxiety, ADHD, people who misuse, abuse drugs or alcohols, or people who may have an eating disorder. If you feel uncomfortable or unsure if you or someone you know has bipolar disorder or even needs support, there are helplines that you can call and are always accessible to you. They can provide information on what the disorder is and what it looks like.